Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Long's Drugs and Beachside Roofing.
Well, good morning, Hawaii. Thanks so much for tuning in here to Spotlight Hawaii on the platforms of the Honolulu Star-Advertiser. I'm Ryan Kalei Suji, joined by Yunji Denise. And Yunji, this morning we head back to the Hawaii State Capitol to catch up with the governor.
That's right. He gave his State of the State address yesterday. We want to follow up on some of the initiatives he laid out and get a sense of what's happening when it comes to the COVID response. Good morning, Governor.
Aloha, Yunji. Thanks for having me on again.
Well, it's great to see you. This morning we have 2,050 cases reported, so it does seem like the trend is heading in the right direction. How are you feeling about where we are when it comes to COVID and particularly hospitalizations right now?
Yes, thanks, Yunji, for that question. You know, we are cautiously optimistic. Yes, today's count is 2,000, just over 2,000. So we have seen a tailing off in the number of cases. And I did ask whether we still have a backlog of the case counts in the system, and it's not. So this is a true number. There's not backlog positive. So, you know, we are hopeful. You know, at least it seems like it has plateaued. Our hospitals do have a lot of cases. We're at about 413. That's tapered off, and you know, we were pretty aggressive in bringing in traveling healthcare professionals, nurses, doctors, and medical technicians. And you know, 2 weeks ago we had more than 330 or so arrive, and this past weekend another 330 or so. So we have about 670 traveling healthcare professionals who have arrived here, and that really has provided a sigh of relief for our hospitals. You know, they had many of their healthcare professionals that either was exposed or had come down with COVID, and certainly we were very, very stressed for the last couple weeks.
We're seeing some policy changes being made from private entities to include the third shot as being defined as fully vaccinated. There has been no official word from the state to include that within any sort of regulations or restrictions for any of the programs that have been set up because of COVID-19. Do you anticipate including that third shot to fall under the fully vaccinated term for things like safe travels or any other restrictions for those who need vaccine verification?
Yeah, Ryan, you know, we are considering that for the Safe Travels program, and we've been working to understand what work is required. You know, we have to reprogram the Safe Travels application and website, you know, being able to work through all the details of what would be required to get the vaccination status up to date, meaning that people who are eligible have taken a booster. That's taken us a little bit longer. And, you know, we have been working with the visitor industry, the airlines and hotels definitely have expressed concerns. So we're trying to work with them. You know, we are looking at vaccinations for state employees. As you know, Ryan, I did extend the authorization for state employees to be able to get time off to get their booster shots. We definitely believe that those who are vaccinated should get the booster because it really does increase protection for them.
When it comes to that kind of mandate or that kind of requirement, Maui, for instance, now has extended it for their Safer Outside program that you do have to be their definition of fully vaccinated includes boosted. There had been some talk early on of perhaps creating a program like Safe Access Oahu or like Safer Outside statewide. Has that idea been dropped, or is that something you're still considering?
No, Yanji, as you know, we have asked the counties to be responsible for restrictions and programs on each of their islands. We've had discussions. I continue to meet weekly with the mayors, and we do talk about next steps. We talk about the booster shots and how it impacts county and state employees. And we do talk about safe Oahu access or, safer travels on Maui. At this point in time, we don't believe that we'll be going to, a statewide program. Again, we recognize that the conditions in each of the counties are different, and there might be better solutions for the counties.
One thing that will be coming up is many people can expect to find their at-home tests that the federal government has been, has unrolled their plan to get more tests into the hands of people at home. Having said that, we also recognize that could also impact the actual number of the daily reported numbers of COVID-19 cases, because we know that the State Department of Health says that they really can't quantify, or there is no way of tracking those who test positive through at-home tests. Are you at all concerned that with the influx of these at-home tests, that there could mean, not really getting a better sense of how many actual cases are positive, knowing that all those at-home numbers won't be reported?
Yes, Ryan. I did want to start by saying, that people who haven't signed up to get the at-home test should sign up. I did, so I'll be getting some of those at-home tests. I'm not really concerned about that, Ryan. We want to have a lot of tests available for the general public. I know for me personally, sometimes I find out that, someone that I may have met or, came to a meeting or something, tested positive, and, having that test and being able to test myself and determine whether I have COVID or not is just, peace of mind. We always knew that we didn't get 100% of the COVID counts, just because some people get COVID and they don't get tested. And we are only getting those who take the time to get their COVID test. The other thing about the at-home tests, I know people who get a positive in an at-home test typically want to confirm it, and they do go to Long's or one of the pharmacies and get a test done, and then we get that number anyway. So, I think overall, Ryan, it doesn't really change the prevalence of the disease. I think it's really peace of mind, and it allows people to really test themselves if they think they've been exposed. And, most of the time they get a negative result back.
We have a question here from Lisa, and I wanted to bring this in. She says, other states are ending the mask mandates for our keiki. When does Hawaii plan to do the same? I have a kindergartner, and she wears a mask to school every day. She's fully vaccinated. And while I'm grateful that she's adapted to wearing the mask, at some point, I really hope that she and her classmates can take them off, because I do worry about, if there are impacts of wearing it too long in terms of learning loss, or just, you learn so much from reading faces, and our kids aren't getting to do that. So what do you say to Lisa and other parents? Well, let's talk about the mask mandate broadly, indoor mask mandate, if that is something that you're at all looking at changing anytime soon. And then specifically for kids, if you are anticipating any changes there.
Yes, Yanji, the masks is the one area I think that, individuals actually have control about how much exposure to others who might be sick around them, or even if they're sick, and, preventing them from infecting others. So, we do believe it's an important part of our layered approach to keeping people healthy and safe. So we are not really looking at dropping the mask mandate, especially indoors. Omicron still continues to be a very infectious disease. In terms of masks for children, we are working through that all the time. The Department of Health has been working with the Department of Education. They have a team assigned to the schools and really trying to work through the different issues for them. We don't want to require it longer than it is helpful. We're hoping that the case counts really come down like many people anticipate, and that, masks would not be required anymore. I do know that it's a challenge. I've spoken with parents who have very young children who are not eligible for the vaccinations at this point in time. And it's definitely a concern with them, especially early childhood providers. I do think that the mask will be with us for at least a bit longer.
I know that we have a number of the COVID questions still that are still coming in, but we did want to switch gears and we can come back to more COVID related questions later. But there are a lot of things happening and we want to make sure we spend some time talking about many as we can. Want to quickly address Red Hill and a situation there and what's happening. If you can provide any update from that you've received from the Navy and from the military on what that status is, and more specifically, when you think some of those families that have been displaced and are currently living in hotels and in other accommodations, when they might be able to return home.
Ryan, we are working with the Navy to make sure it's safe, first and foremost. So we have been working with them on their flushing plan. We've been sampling the water in those communities that have completed flushing. If we get readings of fuel in the water still, then we won't let them back until we're certain that there's no fuel in the water. So at this point in time, the flushing of the neighborhoods continues. I don't believe that any of the developments have been cleared for return. I know the first batch of tests we got back still had fuel in the water, and so I know that many are anxious to get back home, but we are not going to allow them to return until we believe it's safe. We have been working with the Navy, and we're pretty close to being able to pump water out of the Red Hill well. There's an elaborate filtering system that they've set up that will go through multiple filters in stages to clear the Red Hill shaft of any fuel that might be in there. We believe that would allow us to try to get the fuel out of the Red Hill well in a safe way. There's multiple filters. We believe that it would remove most of the fuel that is in the water before we dispose of the water.
That would take care of the fuel that we know about where it is. But, Ernie Lau has said on this program that there is a danger, of course, that some of that water could migrate over to the Halava shaft and beyond and contaminate the city and county of Honolulu's water. What are your thoughts on whether those wells will ever be able to open up? Or do you think that, those are sort of shut down for good, or at least until we can really assess whether or not that fuel has migrated? And he said here that could take months, if not years.
Yeah, Yunji, I think we still haven't determined how the fuel got into the well, and that hopefully we are hiring an independent assessment team, and they'll be looking at trying to determine exactly how much fuel was released and what the point of contamination might be. Until we get that, it's really hard to know whether we've removed the threat from the aquifer or not. So, I do think that starting to pump water out of Red Hill will at least allow us to try to pull the fuel, through the pumps. It would get into the filter, so we could remove it before we dispose of the water. And we're hopeful that that stops any contamination from spreading into other parts of the aquifer.
You're muted, Ryan.
Sorry about that. At this point in time, you would think 3 years in, I'd be able to recognize that. Anyway, at this point in time, when you look at where we're at with Red Hill, it's really about, as you mentioned, just trying to determine where the leak is coming from and flush the system. But when you look at the long-term plan for what this facility was built for, what it was used primarily for, we know that it is an important part of the military's day-to-day procedures with its fueling station. What do you think overall the future of this location is? And knowing that it's important, of its importance to the military, how do you think the state would work with the military and what the future overall would be for this facility?
Ryan, we are working in partnership with them. Obviously, we will not allow them to proceed if the water is jeopardized in any way. And so, the tanks were able to contain fuel for a very long period of time. Our order orders them to defuel and remove all of the fuel from all of the tanks. That's important to us because we do want the Navy to assess other areas that they can store fuel outside of Hawaii. We want them to understand how much capacity we have within the state to store fuel, and really make sure that they examine alternatives to the Red Hill fuel tank. The second part of our order requires them to get an independent assessment and really just make sure that it can be safe. They committed to double hulling the fuel tanks or the best available technology. We want an independent assessment about whether in fact you can improve the fuel tanks so that leaks won't happen into the future. And if they are able to do that and then implement the changes necessary, then we would consider issuing the permit and allowing them to refuel the tanks and continue operations.
So it sounds like getting rid of the tanks for sure is not necessarily your sort of line in the sand here, that you would be open to having this facility up and running if you felt that safety measures could be met. Is that right?
Yes, but it would have to be, they would have to be able to identify safety measures and implement them before. Yanji, we recognize how important Pearl Harbor and the Department of Defense is, to the peace in the Pacific region, but also the economy of Hawaii. And certainly we understand that jet fuel and diesel fuel for ships is a vital component to continuing to operate. So we want to make certain that the Navy can operate the fueling activities in a safe way that doesn't jeopardize our aquifer. And if they are able to do that, then we would allow them to refuel the tanks.
On Monday, you delivered your final State of the State address and outlined your vision for this last term that you enter in and this next year. One of those initiatives, the key initiatives that you had mentioned, was really investing in technology and really building up the infrastructure of the state. What specifically does that look like for you? We know that there is a large amount of money that you would like the state to invest into this area. But how do you think that specifically would play out for, say, the neighbor islands, and where would that investment be specifically in?
Yes, Ryan, we see really high-speed broadband in the most populated areas of every island. For sure, broadband is widely available here on Oahu to most communities. In the big communities, Hilo, Kahului on the neighbor islands. But it is really less so in Molokai and Lanai. So, Apaka Kala is about trying to make sure that we can build the middle mile, what's in the industry, the middle mile technology and use government support for that to ensure that we get fiber to every single island, including Molokai and Lanai. And that provides a baseline. And then we do envision a public-private partnership so that, right now, all of the broadband investments are really being driven by economics. The providers are providing services to the communities that they have a lot of customers. There's significantly less investment to go to rural communities like Ka'u or Hawaiian Ocean View Estate. So, we want to put in that state broadband middle mile infrastructure that gets close to all of these communities, and then invite private partners to use the state asset in a way that delivers quality broadband services to every corner of the state.
I want to follow up on something else you mentioned in the State of the State, and that was $100 for every person in the state, along with dependents as well. How did you come up with that figure? And I'm just interested as to why everyone needs it, because certainly there are some families in Hawaii that are doing quite well, and maybe $100 won't make a difference. But on the other side, there are other families who $100 could be very meaningful. And if you gave them even more, in other words, why not scale it so that families who make less money get more of that share? Why does everyone need the $100? And what do you think that kind of an impact that could make on the economy?
Yes, Yanji, it's always kind of a debate about how we provide assistance. We have had a lot of assistance for those most in need. The entire state's social safety net is really driven by distributing resources to those who need it the most. When we talked about, everyone was impacted by this pandemic, and we really wanted to look at a proposal that returns something to everybody. And I know that reduces the amount that we might be able to do, but we really felt that it would be important for everybody to get something back from their state government.
Something else that was brought up as a potential initiative in your final year here, but that wasn't necessarily mentioned in your State of the State, was this idea of a statewide policing system. You had mentioned that Hawaii is the only state in the country that does not have this. Well, why do you think now is the time for us to move into this direction, and something that you will be advocating for in this next legislative session?
Yeah, it's just a couple things, Ryan. Our proposal is really focused on trying to reorganize state government in the best way to serve our community. We do have a state sheriff's department, but it's very, very limited. For the most part, they provide security at state facilities. And what we're talking about right now is they are part of the Department of Public Safety with corrections. And as you know, there's been a lot of discussions about changing policy on law enforcement side, a statewide law enforcement standard. At the same time, there's been a lot of discussions about correctional systems improvement and transformation. So this proposal is really trying to create two separate agencies that have the ability to focus on what their mission is. It is an area, both areas have significant concern and advocacy in the community. We just believe that the proposal would allow us to get a director and leader in each of these areas that really would focus on the transformation that the community wants.
In your speech, you made headlines not only with what you said, but really how you said it. Today, the paper, focusing on that last little bit where you got pretty emotional. Can you tell us a little bit about why you choked up toward the end and what you were feeling in that moment?
Yeah, Yanchi, I was disappointed. I was hoping that the State of the State would get back to normal, where we would have the opportunity to invite people to the Capitol. We invite business leaders. And in the last 2 years, as I've dealt with the pandemic, I've had many outreach meetings with a wide range of people, restaurants and attractions and hotels and airlines and business roundtable. I mean, I appreciate that everyone was willing to provide input and comment. And I really wanted the opportunity to thank them. And not having the State of the State be in person really meant that we would have to do it virtually. So, I really struggled with what would be the best way to do that. It got emotional. I don't know if I'll have another opportunity, and COVID continues and the pandemic continues. But I did really want to express my appreciation, in all of the meetings. And we knew that restaurants were really devastated by this pandemic. But, the conversations we've had with the Restaurant Association was really about how do we change to be safer? What is it that we can do? How can the state be helpful? It really wasn't about Governor, you just got to let us open. We're dying. So I do appreciate that everyone had the community's interest throughout this pandemic. And I wanted to have some opportunity to express that.
As we wind down the conversation, wanted to head back to COVID-19 a little and just address a few things. I mean, you look at the numbers, obviously it is moving down, but, we're still in a range where we're seeing, 4-digit numbers in cases and in the thousands. And there are people in the community that are still worried about where we're at. There are others, though, on the other side that feel like Hawaii continues to be the most restrictive and that we need to just kind of get over this. How do you find that balance right now between two sets of populations in our community, some who continue to be concerned about where we're at, and those who feel like this has gone on for long enough?
Well, I think we all struggle with that, Ryan, and when I meet with the mayors, it's always that balancing act about, how can we get back to normal and keep our community safe. So, we do recognize, and we have been trying to focus on the things that have the biggest impact. That's why you asked earlier, Yanji, about mask wearing. We do know that when people wear masks, it does make a difference. And so we want to keep that in place. And people can control that, right, to a large extent, about wearing their masks to keep themselves and those around them safe. We would not consider like a stay-at-home order, right? That would impact a lot of the businesses. We've been working with the restaurants, and they've been implementing different changes to their operations. It's those kinds of things. So, Ryan, we continue to try and see what policies make the best sense for the broadest cross-section of people. We will be implementing things when we believe that it's necessary. I'm thankful that the Omicron has kind of peaked now, and the hospitals with the additional support are in a much better place than they were 3 weeks ago. And so, I'm looking forward to the numbers dropping and the day that we can stop all of the restrictions at some point.
I think we all are looking forward to that. Thank you so much, Governor David Ige, for joining us live from the Hawaii State Capitol. We appreciate your time as always.
Yeah, aloha. Thanks, Yanji. Thanks, Ryan.
Thanks, Governor. Aloha.
Interesting to hear from the governor there. We covered a wide range of topics, of course, covering the pandemic at the top of the hour, or at the top of the broadcast, and hearing his sort of sense that the hospitals are steady and stable, that the influx of healthcare workers, 300 early on, and then another 300, I believe, just arriving in a matter of days, that is making a big difference in terms of keeping the hospitals steady and able to meet the needs of our community. Also talked about masks, no plans to get rid of that anytime soon, and the booster requirement, potentially adding that to safe travels, saying that it is something that they're working on potentially, but that they continue to meet with industry leaders right now, hotels, hospitality, airlines, what have you. And so they're not ready to make any changes just yet.
Yeah, no changes just yet. I think that is the key term. There have been some media outlets that reported that the changes to include that third booster into a qualified vaccinated traveler was going to take effect in 2 weeks. And the governor saying again on this program that that simply is not true, that they are still working on it. They're looking into it. They're looking at what requirements the state would have to do to implement that into the system. And that while it is something that they are looking into, it is not something that is policy yet here in the state of Hawaii. So we'll continue to keep posted on that and see if any changes come to the Safe Travels program to include any changes, which would be that third shot, or if testing may be required back into that as well. But the governor seeming optimistic about some of these numbers and where we're heading, but also you heard there at the end them trying to find a way to balance out and where they stand in just managing COVID-19 as we move forward. We also heard comments and updates on Red Hill saying that they continue to work with the Navy on flushing the system. At this point in time, they are not confident, nor do they feel that it is safe for those who have been displaced because of the water treatment, because of the water conditions, to move back into their home or to their facilities. And we also got an update and his thoughts on what the future of Red Hill would also look like moving forward.
Yeah, that was very interesting because he didn't say that he wants the tanks drained forever. He said that if the military can prove that there are safety measures taken and upgrades made so that this fuel can be stored safely, it is something that the state would consider issuing a permit for. There are plenty of folks who have been quite vocal in our community that want that facility shut down for good. The governor stressing the importance of Hawaii to the Pacific region when it comes to being able to refuel planes and ships and what have you, also emphasizing the importance of the military community on our economy. And so saying that he wasn't ready to say that those tanks should be gone forever. I think that is that's some news today.
Yeah, and he did mention that there would have to be an outside third party to verify to make sure that it would be safe. So we'll have to wait and see how things progress, and maybe some time before we even get to a point where he or potentially a decision the next governor would essentially have to make. But we did hear from Governor Ige as well on his State of the State address that happened on Monday, and hearing a little further clarification on some of his initiatives and plans that he would like to implement. Of course, you can hear some of his responses by watching this again or listening to it on a podcast. But interesting to note that, as he said, he's entering this last year of his reign here as governor, if you will, and looking for an opportunity to make a difference here in this last year.
That's right. So who is going to be taking his place? There have been, of course, candidates that we know about, but then there are some others who are said to be being recruited. One of those is developer Peter Savio. He's going to be joining us on Friday to talk about his views on housing and some of the issues facing the state, and answering the question, perhaps, as to whether or not he's considering a run for the Republican Party. So we're really looking forward to our conversation with Peter Savio. If you've never seen an interview with him, we suggest you tune in. He always has a lot to say. Very colorful guy, and we are really looking forward to talking to him on Friday.
We'll see you then. Aloha.
This episode of Spotlight Hawaii is brought to you by Long's Drugs and Beachside Roofing.